Hi, I'm Tom Calma, the National Coordinator for Tackling Indigenous Smoking. Welcome to this video production. It's going to be about a conference we're holding in Canberra where we're bringing in about 250 of our tobacco action workers and healthy lifestyle workers from across the nation to attend our annual workshop. And it's a workshop where we'll see people coming in to sit down and learn from each other, to develop networks, to collaborate, to get an understanding about how do you approach those really difficult topics of tackling smoking, how do you stop people from either taking up smoking or to give up smoking, and also to look at issues around healthy lifestyle. How do we get people to be more active, to understand what is good nutritious food? How do you get to be able to work on a budget and still live healthily, and how to do exercise? And more importantly, if you're in the community, how do you get to understand that you can go and you should go and see a health professional at some time to get your health assessed, because prevention and early detection are so critical in the health of all individuals.
In the words of the Ngunnawal people, Ngana Yarrabai Yangu, which means you're welcome to leave your footprints on our land now, or in other words, welcome to Ngunnawal country. Thank you.
I'm here to take out as much as I can. There's lots of different stories, and just it's really good to see what other people are doing around Australia.
My passion is, of course, empowering the youth, which I have a background as a youth worker and also media as well. So with my skills, I can hopefully make a difference in our community in Western Sydney.
I really love what I'm doing because it's educating my people about closing the gap and letting them actually know what it is, because a lot of people still don't know what closing the gap is. There's a bit of myth out there about it. So it's just giving them the right story, and then they're able to make their own choices.
Less smoking, better choices, more physical activity, more involvement in school, just things to keep the kids out of trouble and, you know, making deadly choices throughout life, yeah.
It's my great pleasure to introduce our National Coordinator, Dr. Tom Calma. He's also the chair of the Australian Indigenous Leadership Centre and is involved with a lot of other Indigenous organisations. He's going to talk a bit about the future and the history of the Closing the Gap campaign, and how the Tackling Smoking and Healthy Lifestyles workforce fits into that. Please make him welcome Dr. Tom Calma.
Good morning, and you don't realise what sort of buzz it is to be able to see so many people in the room, so many people in your own outfits presenting your organisations. So what I tried to achieve in my presentation was to give an overview about the Tackling Indigenous Smoking campaign, and that's where we've got tobacco action workers and healthy lifestyle workers working in the community, with the community, to be able to come up with some really creative solutions to give up smoking and to lead a more healthy lifestyle. So I looked very much at some of the history behind the development of the program and some of the strategies that are being used by our colleagues around the nation, and tried to present that in a way that looked at the current trends, both national and global, in addressing smoking cessation particularly. And it was so important because smoking contributes to about 20% of all chronic diseases and death for Aboriginal and Torres Strait Islander people. It's a little bit less for the general community, but it's still a real concern. So we need to address smoking and look at innovative ways to be able to do that. And what's critical in all of this is to be able to present it in a way that works with the community and have the community at the centre, so that they can come up with the solutions with us to be able to give up smoking and to lead healthier lifestyles. When we look at Aboriginal and Torres Strait Islander population, and these figures are 2006 census, and what it shows is that people live a long life, and you look at the age distribution, it's fairly significant, but it's even more significant when we look at the yellow, which is Aboriginal and Torres Strait Islander people, because what it shows is that we're a very young population. 50% of our people, close to 50%, are under 30 years of age. And so it's very significant. 40% are under 14. But the converse of that is when we die. And blue represents the non-Indigenous population, which you see lead a very young life, and their rate of passing is not until you get older. Whereas if you look at ours, on the red, it's very high infant mortality. That's that little bar at the bottom there. You know, nearly 6% of our population die in the first year of life. You know, just not good enough. And we progressively die throughout midlife. And so very few of us may reach what the blue reaches, and that's long life. And so that's why what we do is so important in all of preventive health, in all of addressing chronic disease, and in the work that we do both as tobacco action workers and healthy lifestyle workers. When we look at the chronic disease risk factors, the highest risk factor is, of course, smoking. But when you combine the other risk factors like obesity, like physical inactivity, and access to food, you see that's very significant. When I did a report back in 2005 as a Social Justice Commissioner, I looked at what was happening around the world and noticed that we in Australia were dying 17 years younger than the general population, which was different to what happens to Indigenous peoples in other nations, where it's only 6 or 7 years. And so the question was, why is there a difference? Why do we, in a very rich society like Australia, not enjoy the same life expectancy as the rest of the population? And that's where that 17-year life expectancy gap came from, and it was addressed. Nowadays, the government's done a recalculation on those same figures and brought it down to around about 11 years, 10 or 11 years, which is still very significant compared to other nations. And in fact, we see the gap, rather than closing, is increasing because the non-Indigenous population are enjoying improvements in life expectancy at a faster rate than we are. So in 2005, this was a report I put out on achieving health equality for Aboriginal and Torres Strait Islander people, and advocating that we needed to take a human rights-based approach or a community development approach. We had to do things differently. We had to centre it around people, Aboriginal and Torres Strait Islander people, instead of having governments determine what it is. And we set a couple of targets. One was by the year 2030 to have health equality, and that is that we have the same life expectancy as the non-Indigenous population. But by 2018, we addressed infrastructure issues like clean water, sanitation, access to medical services, etc. And that's when the target of halving Indigenous smoking came about by the year 2018. We've got tobacco as a very high priority for government. We've also got a bit of a mood change because back in 2008, Kevin Rudd said that we can't keep on doing the same old, same old. We have to take things differently. We have to centre them around people. You know, there's not a one-size-fits-all approach. It needs to be one that is situation by situation. And that's why even within the communities you work, what might work in one community might not work in another. And that's why it's so important in our role is to work with the community to understand what they do. What we don't want to do is to be pseudo-government and tell people what's good for them. You know, we're trying to change that around. Flip it over and say, you tell us what you want, and we work with them. And there's really a big difference in approach. And this program is the only one that's happening in Australia that works at the federal level, and I'm sure at the state and territory level, that works in this way. You know, for anybody that says nothing's happened in the last recent time, have got to sit down and take a deep breath, because about $8 billion of new monies has been presented towards Aboriginal and Torres Strait Islander affairs by all governments, and so it's very significant. You know, as again the Close the Gap story, in public policy terms, the most rapid, the biggest reform in Aboriginal and Torres Strait Islander history, this reform is, and it's growing. As we said, on average, just under 50% of our population smoke, but in some of our regional areas, and I'm sure that Jan will talk about this in her presentation, you know, 70 to 80% of our population smoke, and we start very young in age. And so that's why we've got to do something about it. Also got the other issue of those people who are exposed to passive smoke in our population. And it's again very worrying the more remote we go, because people are smoking in the car, smoking in the home, and exposing others who don't smoke to passive smoke. And so that's a big issue. In this program, when it commenced, they appointed a national coordinator, me. I work 10 days a month on this program and do other things for the rest of my time. And my job is to provide strategic advice and direction to them, and work with government, and then also get out and work with you in the community and in the field, and I also take on a bit of a role of a lobbyist with government and opposition. Our team's 57 of them, 58 if we count the ACT, and each team will have a regional tobacco coordinator, 3 tobacco action workers and 2 healthy lifestyle workers when they're fully funded. That's what the government's provided us money to do, is to provide a comprehensive service to the whole of the nation, to all Aboriginal and Torres Strait Islander populations, irrespective of whether they're a client of the AMS or the host organisation or they're not. Not only do we deliver the workforce, but we're training 1,000 existing health workers. They're people in AMSs around the nation, or they might be in Medicare locals anywhere. Plus, helping to facilitate for another 13,500 people to access quit lines and so forth. OATSI have got the agreement now in all the heads of agreements that everybody has to have a smoke-free policy in your office, and that becomes a really key activity, because once it's in the host organisation's office, then part of the role is to encourage the other 9,000 Aboriginal organisations out there who are registered either under ORIC or under the state and territory legislation or under ASIC to have a smoke-free policy. And if we can get that across the board, then that'll be a major outcome. Tobacco action workers, I mentioned some of these activities already, but it's about going and working outreach within the community, and in some instances providing some support through smoking cessation programs, but it's really referral on to quit lines, referral on to the clinicians where they exist. And those clinicians may not necessarily be in an AMS. They could be a GP, they could be at a hospital, they could be anywhere who's delivering that sort of level of support. Some of the market research that we've done before this program commenced and since it's commenced is, how do we direct marketing? And what's, in talking to our Aboriginal and Torres Strait Islander populations, family and kin are the major things. So referring back and bringing family and kin in, getting the messages out is most important in that process. Now, this is part of a national campaign. It's just out. You might have seen it, but it's very important. It takes 19 seconds to get to the message, but I'm going to have to try and cut that out, but I couldn't do it before now. But you'll see this one up there, very important, and this is the one where we're also going to try and look at introducing some information about alcohol.
When you're pregnant, everything you do is for 2. You're sleeping for 2, breathing for 2. Everything you do is for you and for your baby. So when you choose to quit smoking and get the toxins out of your system, you're not just quitting for you, you're quitting for 2. You'll improve the oxygen flow around your body and to your baby. You're lowering the risk of miscarriage and serious health problems for your baby. And because it's twice as important to get the help you need, Quitline has people to support you, whether you're already pregnant or planning to be. There's even a free app packed with games and baby fun to get you through the cravings. Phone Quitline today and ask about Quit for You, Quit for 2. Authorised by the Australian Government, Canberra.
So it's about not doing the job, it's about referring people to the right sort of authorities who can provide that quality information to them. This is another one, which is a localised message, which I think is excellent, and there's plenty of them around.
Every day I run. I run to beat the statistics that tell me what I will do and what I won't become. I run to earn my place as an elder and pass on our culture's traditions. To succeed, I have to be strong. But when you smoke with me in the house, or when you smoke with me in the car, you take from me my strength, and I can fail. But I won't quit. I'll keep running, if you help me. Please stop secondhand smoke and help us continue our culture.
This is done by a group of rangers. And you go, well, rangers? Yeah, well, they're people who look after country, and they're people who wanted to get a message across to their own mob about smoking and particularly what they could do about it. These are posters that have been out for quite a while. A very good website that's up there. No smokes, and it's it gives you a lot of information about technical information about how to quit and some of the ways to attempting. It carries a whole range of stories and individuals' attempts. It's not always about the successes, it's about the challenges, it's about the failures, but getting up and having another go. So these all become resources that you can use. This is the one that we produced with our teams and other professionals about nicotine replacement therapies and how to use them. And if you don't have copies of those, you should let us know and we make sure you get them. There's both this guide and a smaller publication that we can hand out to clients so that they can become informed. I closed with this, and that's about racism. You would have seen, you may or may not have seen, that in Victoria recently they did a survey of Aboriginal people down there who said about 97% of them said that they've experienced racism, and that's shocking. And that's takes different forms, racism, discrimination. So it's about all of us making a pledge that we're not going to be perpetrators. If we don't want to be discriminated against, we should take a lead as well. And to remember that we all have a part to play in all of this. And that's it, folks. Thanks.
I think we've got a right to be angry that there are still people selling, promoting cigarettes to us now. People, in my view, ought probably to be in jail when you think of the number of deaths that they've been responsible for. We've got a right to be angry about that, and we've got a right to be angry that so many people are still dying because they smoked. We know what needs to be done about specific issues and as a comprehensive programme, and I'll come on to that in a moment. There's been some action by health groups, but the opposition continues. And anybody working in the tobacco industry now knows exactly what they're doing. They're selling and promoting a product that kills 1 in 2 regular users. So they're even tougher, even more ruthless, even more evil than they ever were before. We've had recently some exciting developments in Australia, but I think we should still be angry because this is a product that still causes 15,000 deaths, 20% of Indigenous deaths. Worldwide, 6 trillion cigarettes are still being sold, and it's causing more than 5 million deaths each year around the world. In 1950, the first clear, overwhelming evidence that smoking killed. So we've known, as Tom said, for 62 years. 1962 and 64, the first major international reports pulling together all the evidence. So we've had strong reports since then. In the mid and late 70s, reports telling us exactly what we know now, pretty much, about what should be done, with the addition that in 1981 we had the first really clear evidence on the dangers of passive smoking. So we've known about that for over 30 years. We've known for decades about the dangers of smoking, over 4,000 harmful products. We've known for a long time that smoking kills nearly 1 in 2, well, about 1 in 2 regular smokers. And we've known since, as the Surgeon General in the United States has put it, that there is no safe level of exposure to passive smoking. We've known this is a WHO report and the previous one, International Union Against Cancer, since the 1970s about what needs to be done to control smoking, not one magic bullet, but a range of measures, a comprehensive approach. So here we are. In the 20th century, smoking killed 100 million people, currently 5 million deaths a year. This century, smoking will kill 1 billion people around the world. And in Australia, in our country, Smoking has killed 1 million people since we first had evidence about the dangers. So you see why I talk about being angry, because we've known about the problem, we've known what needs to be done about it, and still there are people dying needlessly. There is some good news. Smoking is declining, and as my colleague Simon Chapman has pointed out, the rates of disease caused by smoking are declining too. Now, it takes a while, but if you want encouragement, just look to see what happens when people give up smoking. Lung cancer falls, heart disease falls, a whole range of other conditions too. So we're getting somewhere. This presents fairly graphically the way that the rest of the population live much longer than Indigenous people, and so much of that, of course, is because of smoking, the single most preventable cause of death and disease, and the single biggest component to that life expectancy gap. I first came across the way the tobacco industry worked in 1973, when I was working in the UK at the time, and I was starting to make a noise about smoking. And if I was cynical about the tobacco industry, I was even more cynical after I'd started making a noise publicly about smoking, and the chairman of one of the world's biggest tobacco companies, Rothmans International, a guy called Lord Pritchard, quietly approached me and offered me a substantial amount of money if I would work on any other campaign of my choice except tobacco. So that shows you the way the tobacco industry was working even 40 years ago, let alone now. There's never one magic bullet in tobacco. It's a combination of things we know work: price, public education, ending all tobacco advertising and promotion, protecting from second-hand smoke, regulating packaging, including through plain packaging, support for people who are quitting, working in partnership with Indigenous groups and to reduce smoking, boosting efforts to discourage smoking in other highly disadvantaged groups, and so on. And we recommended establishing a national preventive health agency, and we also recommended a special focus on Indigenous smoking. And I still remember Nicola Roxon saying, "By not acting, we are killing people." And I thought, there we've got somebody, a minister, who's actually going to do something about smoking. And sure enough, she did as a result of our report. There was a ban on internet advertising of tobacco. There was massive funding, increase in funding for public education and other activities, more support for quitters, and the setting up the Tackling Indigenous Smoking Initiative, which was to be run by Tom, which I think is just one of the great initiatives that any government's established in this area. They also announced that they were going to go with plain packaging, not as a magic bullet, as part of a comprehensive program, but as something that really does support the rest of the program so well. And something about plain packaging has caught the public imagination, and it's having a huge impact. These advertisements were appearing on television. We didn't know who they came from. We thought they were tobacco companies, but we didn't know, and we couldn't prove it, because they didn't say they were this. See the name, the Alliance of Australian Retailers? And we wanted to prove that they were tobacco industry funded, but we didn't have the proof. And then one night I woke up around midnight, as aging gentlemen do, and I checked my emails, as you all do when you wake up at night. And there was an email from somebody, I still don't know who it was, saying, "Dear Professor Daube, I've seen you on television. Would you like some confidential tobacco company documents?" What would you do? So they came piling in, and what they were documents proving that the tobacco companies themselves were funding those campaigns and directing them from London and New York, not even within Australia. So that became public, and that reduced the tobacco industry's credibility even further. As of December 1st, we have plain packaging. We're the first country in the world to do it. But you know what? It makes me sound like Kevin Rudd, doesn't it? You know what? Other countries are following. They're following plain packaging, and the great thing about it is that it's caught the public imagination, and it's generated huge interest in quitting and support for action on tobacco. And because the tobacco industry opposed it so dishonestly, that, if anything, even increased the support that we have that we found in the community. What are the things we need to remember? We need to remember the size of the problem. Why are we in it? Because it is a huge preventable health problem. because it's killing 15,000 Australians each year, 20% of Indigenous people, 5 million people around the world. We need to remember that what we're doing is a model for other countries. What you're doing is a model for other countries. They do follow, they watch. And if what you're doing succeeds, they'll follow it. We need to remember that there are people who are promoting this product, and we need to call them out every time we can, and frankly make their lives difficult because they're selling a lethal product. And we also need to remember that action works if we stay angry and if we stay with it. Overnight success takes time. I don't think any of us should be disappointed if we're not getting miracle results from any program in a year or 2 years. I think the very fact that there are so many of you here and you're doing so much is already a huge success, and it will be bringing further successes in terms of quitting smoking in the community in the years to come. And there'll be people you never know about who quit because of your activity. I do hope you remember that the big prize is there, that people will be quitting because of what you do, but it is so important that we do stay with it. So I thank you for everything that you do. I congratulate you on this wonderful program, and I look forward to seeing the results in the years to come.
I'll let you in on a little secret, and I told some guys in Perth a few weeks ago, is that in year 12 I noticed a loophole in how I could get through to university. 3 subjects were scored out of 20 and 2 of them were scored out of 5. So I figured if I do well in 3 subjects, I could basically fail 2 and still live my dream and get into uni. So I sat down and I did a plan. I didn't tell my parents this. And I thought, all right, which subjects I'm going to pass, which ones I'm going to fail. And one part of that strategy was actually, how do I let the teachers know that in the classes that I'm going to fail, that I'm going to fail? And I thought, I'm going to try the Jedi mind stuff, because I was a big Star Wars fan. So when those teachers in those 2 subjects came to me and said, where is your assignment? I would just wave my hand and say, I'm not the student you were looking for. Move along. But things worked out okay. I'm here, and I got through. I went through uni, and things always go all right if you've got the right attitude. When I reflect back on being at uni, because I did 2 years of visual arts and then 3 years of commercial illustration, the thing that I got to do was to get this massive experience of all these different things. So, drawing, sculpture, black and white photography, where back in the day we actually had to develop all the film ourselves and do all the paper ourselves. And then, going into illustration, so, you get to learn as electives package design, graphic design, typography is where the art of actually just putting type on paper, all that sort of stuff. And so that just filled my head with all this knowledge, which is just, it's one of those 3 things, it was knowledge. All that stuff just is what I got exposed to. Now this is where it sort of ties together. This is a thing called the innovation engine. And it's created by a professor from Stanford called Tina Seelig. And she specialises in creative thinking and all that sort of stuff. The things that I talk about form the internal part of this innovation engine. The knowledge. One of the best ways to increase your knowledge is just to pay attention to stuff. Observe and wonder, I wonder a lot. I often just wonder about how things come together or how artists have done certain things. So your imagination, most people start talking about creativity by thinking about imagination. And how do you increase your imagination? So it's the way you ask yourself the question about the problem that you're about to solve. So the question basically is the frame for which the answers fall into. So if you're going to ask yourself a really boring question about how do we tackle this particular issue, then it's highly likely that average answers are going to fall into that frame. But if you start opening it up with questions, and I've got an example here, a particular project I worked on, where it was really well known, and myself as a coordinator, the challenge to me was, how do I make a campaign that's bigger than the next biggest thing that's out there? That was the question that I asked myself. Stimulus, and not this type of stimulus. Connecting and combining ideas. Somebody's connected the idea of a skate ramp to the non-stick properties of a fry pan, and then dressed people up as food and done a little ad. That's pretty clever. Attitude. I personally think the attitude is the most important part of this, because if you don't have the right attitude and the mindset and the motivation to work through this stuff, then what I've seen in the past is a lot of people tend to stop when they hit walls and they get frustrated. And those walls could be anywhere, whether it's organisational, administrative, all that sort of stuff. And if you don't have that sort of the right sort of attitude, you don't spend a lot of time trying to connect different ideas and looking at different possibilities and going beyond what might seem like the first right idea to do something and going, say, to the 10th right idea. Because that takes time and a lot of energy to go, okay, it might seem good, but is it good enough? And keep pushing beyond that. The external environment when it comes to the innovation engine, and I'll be really quick on this, is what actually fosters innovation. Okay, so we're all creative people to some extent, right? But you probably know yourself a whole bunch of creative people who never really get to achieve their full potential. And that's because the environments that they work within probably don't foster that type of creativity and innovation. You may be within one of those organisations yourself. So the habitat, so this is the outside world. It's like the people you work with, the rules, the rewards, the constraints, what the physical environment's like. You know, you go to kindy in this type of thing. You study in this type of thing. You go and work in this type of thing. That's not really conducive to creativity. And then you Google the offices of, say, Google and Pixar, and they look like that. Creative workplaces foster that creativity within the workforce. The resources, they come in different forms. A lot of people just think of money, but it could be natural depending on where you come from. And then the culture. The culture is like the background music to our lives and the background music to the organisations that we work within. So as workers in tobacco control, there's never really been a better opportunity than this to make a difference on smoking rates. Like, we are truly fortunate to have this amount of resource, this amount of workforce on the ground at the same time. And having Tom as like the driver of this, I think we're very fortunate for that as well. So it's up to us as workers to be creative, or to be more creative, and to capture people's attention and to make a difference. And to do that, we have to make an effort to increase our knowledge of tobacco control and evidence. Evidence is such a big thing, and I think people sort of disregard that sometimes. Look at all the programs. These types of catch-ups are pretty awesome to work out what is actually going on and cherry-pick what you think is working well. And then lastly, it's the leaders. I don't know if there's like leaders within organisations who are here today, but it's your job to foster environments that really encourage innovation within your workforce and your teams and that sort of stuff. And, you know, you guys have probably done some sort of organisational training that sort of does, you know, workforce output, but really that falls into your hands. So I'm going to leave you on that.
The education program is something that I suppose I'm very passionate about, but the reason being is it's an easy program and everyone should know it. It's a basic education that every Indigenous person should know, but every Australian should know. I work with education department, also with the schools, the primary schools and community organisations, and see lack of knowledge around these factors of chronic disease. When we run this program, we don't come in as teachers. We don't want to be a teacher, we want to be a peer educator. We build trust. For them to trust us, we need to get to know the individual. The program will run for 7 weeks. The first topic and the most important topic is leadership. Understanding our roles as leaders and the individual's roles as leaders, whether you like it or not, and we explain this to young people, community members and elders, you're a leader. It's what sort of leader you are that might influence an individual. whether you're a poor leader or a good leader, and making changes. If you have poor qualities, you can change into good qualities. Doesn't make you a bad person, just you might have some, I suppose, gaps, and we're all human, we all make mistakes. When we talk about the modes of delivery, we talk about different settings. We talk about high schools, community groups, and we talk about primary schools. Each person will get an understanding and, I suppose, their assets in delivering. For me, I work well with young people, I work well with men, and my communication is good, but for someone that hasn't worked with elders a lot, you wouldn't actually ask them to deliver this to elders. If you've got people that are strong with primary school students, you'd get them. Use your assets to deliver the program to who you're able to. When we talk about nutrition, we talk about the importance of breakfast. Breakfast is important, but why is it important? Now, that education should be the same across rural, remote and urban settings. Same as physical exercise. You might do different physical activity, but the importance and the education of it is the same in all those three settings. We talk about the program as being adaptable to that area, also being transferable. Leadership is the only thing we ask that an organisation would do first. One, because it's a cornerstone. Leadership leads into, okay, understanding you to be a better leader, you need to understand chronic disease. Okay, you to be a leader needs to eat breakfast, so your little brother watches you eating breakfast. He wants to eat breakfast every morning. And it passes on, whether it's relating to mum or dad going to work every day. And those kids then wanting to work in that same organisation because mum and dad. That leadership is a cornerstone. It should be for everything. We want to expand more. I've probably delivered this program in the last 12 months to 13 schools in southeast Queensland. With that in mind, we're hoping to have 13 schools in term 1, and I've pretty much got 10 locked in for term 1 for next year. So if we can get to 40 schools with roughly anywhere from 12 to 30 participants per school, we hope it goes nationally wide. We want it to go to all parts of Australia, because one message, which would be daily choices, can be so broad, but it's still one message and everyone will relate to it. Okay, and it's for Aboriginal and Torres Strait Islander people and their health, but also their education, workforce, employment. The development of daily choices, another thing that we're looking at, and we've sort of just been getting into it, is actually accrediting the course so people actually get something out of it, not just an education, but as everyone knows, you need a piece of paper these days to get anywhere. So if that can give someone a reward or an effort to participate in the program and get educated, not just for their health, but to have a piece of paper they can put in their resume, it's a good thing. It's something that we're, I suppose, very passionate about, and it's built our preventive health team very strong, and something we'll continue to work and build on into the future.
My life has been a lot about firsts, and that's a luxury, and I guess it's something that I really enjoyed. I had role models and I had people that did things for me my whole life. Like most of you guys in this room, the programs that you guys do and things like that is no different to what I'm doing. In my life, I was the first person from my family to graduate from Year 12. I was the first person in my family to become I was the first person to become an elite athlete in my family. I was the first person to become elected to a national board looking after Indigenous sports. But Canberra holds some significant things for me, like I'm sure with most of you guys here. For me, Canberra was my first school excursion, which meant my first trip away from my grandmother, which was very hard. Obviously, and Canberra holds another significant place for me because I actually made my Super 12 debut, and I know that when I say Super 12 that I'm giving away my age a little bit, but it was many moons ago that I actually got to play down here at Canberra Stadium, and obviously had the luxury of having my grandmother and grandfather in the stands. That was a first. In saying all of that, it doesn't change who I am. It just means that I was then again finding it hard to be in a place where I would come home and my community would still question, why aren't you playing rugby league? And as a 17 to probably 25, it was probably one of the most confronting questions that I had to answer, because it was almost like I was having my Aboriginality challenged by my own community because I was not doing what I was told. Now, as a boy, everyone seems to forget that on Fridays we played AFL, on Saturdays we played rugby, and on Sundays we played rugby league. So to me it was just normal. In saying all that stuff, I actually have the luxury of also have been played for Australia and representing my country. My grandmother always taught me that representing my country was something that was very important to her and to me, but I was also representing my people. Standing in the room here today, being one of only 10 Aboriginal men that have represented this country in rugby union doesn't seem correct. But is it something that we can change around with role modelling and focus and things that you guys do? When I first started in the community, it was one cold winter's morning on the Central Coast, and I was walking into our local rec centre like every other morning, and 5 young men were sitting outside in the concrete pylons. Couldn't have been any more than 5 degrees temperature. The boys looked at me and they said, "Unc, where are you going?" And I said, "No, I'm going inside, did some training this morning." One of the boys replied and looked at me and said, "What's in there?" And I said, "It's the rec centre, there's a gym and there's facilities and, And the young fella said, "Oh, all right." He goes, "But what can we go in there?" And I said, "Well, and then led me to believe that the next problem was there was a cost. So went home and I said to my wife, what I want to do is I want to donate some money to the rec centre so these kids can use the facilities in the morning. Stumbling along, moving forward, was then I realised that our community and our kids needed a place to come together to socialise and feel welcome. They needed to learn their place in the community, and they needed to learn about healthy ways of doing it, and they needed to be encouraged about the benefits of school, but the benefits of being role models as Indigenous kids in our community. Because our kids, and I'll say this a lot during this speech, is our kids come to get educations and they come to get things. The one thing I think that we underestimate is that our kids come to give one too. The mainstream society, when they see our kids do prominent things, they almost look in amazement and they think, "Oh wow, how did they do that?" or "Why did they do that?" Where we all know that our kids are full of success and full of brilliant things, as well as any kids full of negative stuff. So the Neuro program was developed, and now the children receive their level 1 in Aboriginal history, which contains everything from healthy lifestyle messages from cardiovascular disease to diabetes, to health, to infrastructure, to the simple life skills of filling out forms and being active parts of the community. The kids also receive their level 1 in sport and recreation, which is the physical activity component. So our kids learn to combat things like cardiovascular disease, they learn about diabetes, and they learn about how your health can affect those issues. Our children then also participate in their bronze medallion. One of the big services in our community was when they erected a pool for us, and they got a pool in. I can now say that out of the 19 staff that they have at our local pool, that 17 of those are Aboriginal children that have come through our program. And it just came through simply asking questions and saying, well, this is our land, this is our community, these kids need employment whilst they're finishing school and whilst they're looking at going on to further things in life. And that really struck a match with me. It really got me thinking and really had me look into things and thinking, if I can acknowledge that, and I can make that change with just one simple thing of an employment with a bronze medallion, and this, what could be possible if I worked a little bit harder? The next thing I knew that the competitive drive in me had kicked in, and like most people that you guys deal with, I was addicted. I was addicted to the want to help, and I was addicted to the desire to achieve. We started with $10,000, working with a group of 10 kids. We then moved on, and now the program's operating 4 years later on a budget of $750,000, and we're employing people in our own community to deliver our own things. The program now has moved into a place where we're employing Indigenous and non-Indigenous people to spread the word about how positive our kids can be. A lot of these kids in Year 9 and Year 10 are struggling to commit to school and move on to life into a positive thing. Now, our kids on the Central Coast, we have a 30% graduation rate through to Year 12. 70% of our kids aren't getting there. Central Coast of New South Wales, this is a city. When I started the program, a lot of the kids knew who I was and what I had done, obviously from being in the community for so long. And I thought to myself, what am I going to do when the kids are getting younger and younger, and then these kids are looking at me going, I really don't care what you've done, I don't care who you are, I'm not listening to you. Then made me start to believe that what I need to do is create our own role models within our own community. Really work hard with these children to achieve their goals, set their goals, and make these things achievable. The program, as I said, in 2010 took a turn, and like most programs, the funding runs up and you think to yourself, oh, well, when it's up, it's up. And the turn was that I was moving into duplicating the program. I was moving the program into places like Canterbury, Port Macquarie, Walgett and Newcastle. Then I had to look at why I did what I did and how I was going to make it happen. And I quickly realised through things that my grandmother used to say to me, and one of them is that there's three emotions and they nearly run together. And she said to me, smile, son. And she said, smile at somebody you don't know. And she said, the feeling you get when you get that smile back. And I was like, I got no idea what you're talking about. And she said to me, all right. And she said to me, laugh. Laugh. Laugh with somebody that you love. And I'm like, okay. As an athlete and as a young bloke, I was like, still not getting it. And she says to me, and the last one, she says, is cry. And I was like, hell no. I said, no, black men don't cry. And she says to me, she says, not cry, you idiot. She said, want something that bad that you could cry for it. And I was like, holy shit, I understand that. I could go to bed dreaming about what I want to do and how I want to do it, and I wanted it that bad that I could cry. So then I found myself smiling at every person I walked past in the street. I found myself going to family barbecues, being the loudest person laughing, and life became a different place. Now, the sad thing is that I asked my grandmother where she got that from. My grandmother turned around and said to me, your grandfather said that to me my whole life. My grandfather passed away and I never got to ask him where he got it from. Quite ironic. And I think to myself, wow, we all have amazing people in our lives. We've just got to choose to use them in the right way. So in 2012, nearly 6 years into having this running, the Aboriginal community on the Central Coast has 15 children enrolled in university. We have 22 children enrolled in trades. We have 25 full-time employees within our local community, and we have 3 professional athletes. Thank you very much, guys.
Can I say that from the get-go, Warren's been our #1 supporter, advocate, fan, and gets around and sees many of us around in the community, and is a real champion for Aboriginal and Torres Strait Islander health. So, Warren.
Can I welcome all of you from wherever you've come from, and can I pay my respects to your elders, past and present, in your own countries, because it is very important that we accept and acknowledge where we all come from, but also those who have gone before us. And I believe also we should be looking forward to those who are going to come after us, and those people who are going to come after us are going to live a lot longer because of the work you're doing. So that's really very important. I can tell you, most assuredly, how much we value the work you're doing. Not only as tobacco action workers, but healthy lifestyle workers. The work you do is going to be fundamental in changing the way in which Aboriginal and Torres Strait Islander people live. Fundamental. And I don't have to tell you about the importance of stopping people smoking. At the moment, we have about 48% of Aboriginal and Torres Strait Islander people around this country who are still smokers. In some communities, it could be as high as 80%. Now, we know what the burden of disease is as a result of tobacco smoking. We know the early deaths that will occur. We know the costs to family, community and the country of these early deaths, which are directly attributable to tobacco consumption. We know the burden of chronic disease, which is a direct impact of tobacco consumption. So your work is fundamental. If we actually are to close the gap in life expectancy between Aboriginal and Torres Strait Islander people and the rest of the community, then we must get people smoking less. And if we can meet our objective of halving the smoking rates by 2018, that is to 25%, we'll have achieved together a great goal, a great goal. And so the work you're doing is absolutely crucial to giving us the means to challenge assumptions about people's behaviour and about their lifestyles. And if we can get people to accept, and it's difficult, it's bloody difficult. I've relayed, I think, this issue before, to some of you at least will have heard this. I attended about 18 months or so ago a meeting of the Northern Land Council in Katherine in the Northern Territory. The purpose of my meeting was to explain my job as Minister for Aboriginal and Torres Strait Islander Health. I started by talking generally. It's a mixed group. Some quite old men, some relatively young people, some women. And I started by saying what I did, how important it was to be healthy, etc. Then I said if there was one thing you could do to help life expectancy, to help health, would be to stop smoking. And one old bloke who I know very, 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 very well got up and said, "Warren, we can't do that. We can't just stop smoking. That's part of our culture." He said, "When I grew up and I was working on the cattle stations, they paid me in flour, sugar, tea and tobacco. So that's what I do. I smoke. It's part of what I am. I can't stop that smoking." Now here's a bloke who I think probably now close to 80 and is, for all intents and purposes, quite healthy. So it's very hard for me to say to him, "Mate, you look crook." But in fact, the message was very clear. So it's very hard to get people to adjust their mindsets because of their historical behaviour, because of learnt behaviour, because of the way in which they've been socialised, and the fact that makes it very difficult in some places. So your job is hard. But in any event, I said, look, I understand it'll be hard for you to stop smoking, but for God's sake, can you tell your kids and grandkids they shouldn't be smoking? Give them the message. And that's what we've got to do. And that challenge is yours. And the other element is healthy lifestyles. Well, please, if Tom can do it, if he can do it, he will do it. He will do it. He is doing it. You know as well as I do what it means. You know, and there are very many great initiatives which are being done right across Aboriginal Australia, Aboriginal and Torres Strait Islander Australia, to make people aware of the need for healthy lifestyles, to make people aware of the need to eat good food, to make people aware of the need for rest, recreation and exercise. And you know and I know that there are very few Aboriginal communities across this country where young people don't want to be active. What we've got to do is provide the mechanism to make sure they are active. And if we can make people healthier, aware of their fitness, aware of what it means to control their diet, make sure, for example, they don't drink as much high sugar content drinks, get them off the Coca-Cola, the Sprites, and get them onto low sugar content drinks or no sugar content drinks like water. Get people to understand that overconsumption of alcohol and other drugs is not good for them. Most people know it, it's just hard to do it. And your job in this area is absolutely crucial. So can I say thank you to you? Really, from the bottom of my heart, thank you. Because what you do is going to be so important for not only the current generation of Aboriginal and Torres Strait Islander men and women, but for future generations. You know, those people with chronic diseases now, it's going to be very hard for us, really. We might be able to prolong their lives, but we can't resolve the internal conflicts that have happened already. But for those young people who have yet to embark on the course of their own physical abuse by smoking, eating the wrong foods, not taking exercise and the rest of it, there is an opportunity. And that's our challenge. To work with them to make sure that they live long, healthy lives. That's what it's about. Ultimately, it's a very simple thing. We want every Aboriginal and Torres Strait Islander person born in this country to have the same life opportunities as the rest of the population and to live as long and to have a high quality of life. And you are fundamental in that. So don't let anyone tell you that what you're doing, you know, isn't that great. What are you doing? Oh, I'm stopping people smoking. Well, you take great pride in that. You take great pride in the fact that most of you, if not all of you, work with really good organisations, Aboriginal and community-controlled health service organisations, private organisations, NGOs, that you are proud of what you do, because we're proud of you. Thank you.
What this conference is about is saving our people's lives, you know, my people, Aboriginal people. So yeah, I'm really glad to be a part of it.
What I got out of the conference here today is the public speaking. So it was a keynote to see a lot of Indigenous men there to understand that public speaking is well good for the young kids. You know, they got to be role models for the younger men.
It's so fantastic to see that so many Aboriginal organisations and communities are actually involved with social media. It's all about getting the word out there in regards to tackling smoking and healthy lifestyles, and the more we can actually promote it, the better.
This type of conference and workshops really allow you to realise that you're not isolated. There are a lot of other people in and around the country that are doing similar and same type work for the total or for the benefit of our better health for the future.
Well, I hope you've enjoyed watching these highlights of the conference that we've had in Canberra, where we've shared information and looking at the theme of our conference. It's important that this information is shared amongst yourselves and understood. And I'd like to thank all of those who participated in the video because it's your information that's helping us to be able to change our lifestyles. So stay healthy, stay smoke-free, and we'll catch you again later on the Rural Health Channel.